Is long-term occupational therapy for stroke recovery expensive? Imagine working hard to regain your independence after a stroke, but wondering if the journey will also drain your finances. Long-term occupational therapy can indeed be costly, but costs vary widely based on several factors. The type of care you need, whether you are in an inpatient facility or receiving outpatient services, plays a big role. Inpatient rehabilitation, which involves staying in a specialized facility, tends to be more expensive because of the intensive care and round-the-clock support. Outpatient therapy, where you visit clinics or therapists regularly, generally costs less but still adds up over time. Research shows that the total costs for stroke rehabilitation in the first year can be quite high. For outpatient care, expenses can exceed $27,000, while inpatient care can go beyond $70,000. Occupational therapy often makes up the largest part of these costs, especially during the initial recovery phase. On average, occupational therapy might cost around $900 per patient each year, but this can vary depending on how often and how long therapy sessions last. Some newer approaches, like robot-assisted therapy, can have higher upfront costs, sometimes over $5,000 for a 12-week program. However, studies suggest that these therapies might be cost-effective in the long run because they can improve recovery outcomes and reduce the need for ongoing care. This means that investing in certain therapies could help you regain skills faster and potentially lower future healthcare expenses. Insurance coverage is another important factor. In the United States, Medicare often covers occupational therapy for stroke survivors, especially if certain medical criteria are met. But coverage is usually limited in time and depends on the severity of your condition and your progress. Patients might still face out-of-pocket costs such as deductibles, co-insurance, or expenses for services not fully covered. Having supplemental insurance can help lessen these costs. The length and intensity of therapy also influence expenses. Recovery tends to be fastest in the first 3 months after a stroke, but therapy may continue for 1 to 2 years to support ongoing improvements or adaptations. Longer-term therapy, even if less frequent, can add up financially. The severity of the stroke and the level of impairment also impact costs, with more severe cases requiring more intensive and prolonged therapy. In summary, long-term occupational therapy for stroke recovery can be expensive, especially if intensive or inpatient services are needed. However, insurance coverage, particularly through Medicare, often helps reduce the financial burden. It's important to weigh the costs against the benefits, such as improved independence and quality of life, which can also lead to lower overall healthcare costs over time. Patients and caregivers should work closely with healthcare providers and insurance representatives to understand their options and plan accordingly. Always remember, personalized medical advice from your healthcare team is essential to determine the best approach for your recovery journey.